Well, hello, Dina. It's so nice to see you. Thank you for joining me today.
Oh, thank you so much for having me.
Oh, my pleasure. Well, to introduce you to the audience, this is Dina Trounce Shapolis.
You got it.
I
It's a tough
practiced
one.
that. And she is a pain coach. Is that
Mhm.
right?
That's right.
Okay, she's a pain coach. And she makes the connection between trauma and pain, which I find to be very interesting because I do suffer from chronic pain, but I have some biological things. Arthritis runs in my family, but I also know that when I'm stressed or whatever, I do feel more pain. So, Dina,
Mhm.
tell us about you and how you came to make the connection between trauma and chronic pain.
Right. So I feel like I kind of just fell into the whole chronic pain world. So I live with intermittent pain. I don't live with day-to-day pain. I am a migraine gal. I come from a long line of migraine sufferers. And so I really witnessed both my parents, my mom with migraines, but more importantly, just a multitude of health issues. She passed away quite young, and I know there was a lot of undiagnosed conditions that really led to her untimely death. So, and then I witnessed my father, healthy man, and then all of a sudden, things just started piling on top of things, and there was a deep sense of overwhelm to the point where he said, "I just can't make these decisions anymore. I need you to do it for me." And so I really didn't want people to feel that sense of overwhelm. So I became a coach. And once I kind of became a coach, I also teach Pilates. So I work with a lot of people who live with chronic pain. That was my first introduction to chronic pain. And the more I started working with them, the more I really realized, and I saw this in my parents too, not that they had chronic pain, but there was chronic illness, is that there's an awful lot of overwhelm involved and that there's a lot more that we could be doing and that they are really an underserved population, the whole chronic pain community. And so it is my job as a coach to help try to fill in the gaps between the physician care as well as sort of self-care management to the chronic pain warrior. So champion, whatever you want to call yourself, because there's a lot to know, but your doctor just doesn't have the time to talk about it. And so that for me is where I come from. And then as far as making the connection between chronic pain and trauma, that was a huge moment for me where I really thought, oh God, there's really a lot more we could be doing. We know that with chronic pain, that pain is always 100% of the time, both physical and emotional.
Mm.
And the best example of that is trauma. And so when you work with a traumatized patient, now, of course, I'm not a therapist, so there is work that needs to be done with a trauma-informed therapist. But once we start working together on sort of different matters about sort of moving forward as opposed to dealing with the past like a therapist would do, is that really understanding that the emotions, that imprinting of that experience, that lived experience, really impacts pain in so many ways. And so once I realized that there are so many people who were living with trauma and also experiencing chronic pain, it just kind of putting two and two together and realizing, okay, this makes sense. We have the emotional side and we have the physical side, and the emotions will show in the body, and that is 100% of the time with trauma as well.
Well, absolutely. Because in recovery, which I'm a recovering crack addict, and when I was in recovery, we always had a saying, your body screams what your mouth lies about. So you can
Right.
say, oh, I'm fine, but then your body
Yeah.
does remember the pain. I guess there's a connection between that, and there's some neuroscience and some stuff like that which I want to delve in, but not
Yep.
necessarily with you. That's not this
Yep.
topic, but
Yep.
there is scientific proof
Right.
that says exactly what you just said, because some people are going to say, oh, she doesn't know what she's talking about. But
Yeah.
there is, and they are more believers in science,
Mm-hmm.
which it doesn't mean what you said isn't true, but there's
Okay.
actually scientific proof that our cells have a memory and they remember trauma. And so
Absolutely.
that's just so absolutely fascinating to me.
Mm-hmm. Mm-hmm.
So you just touched a little bit on it, but would you mind expanding on exactly what a chronic pain coach does?
Yes. So a chronic pain coach, coaching in general, a lot of people get confused about. So I'm not a football coach. I'm not a volleyball coach. I wish we had a better word for it, but really I like to kind of think of it as a facilitator of change.
Mm.
We study the language of change. And when it comes to chronic pain,
Excuse me.
uh, there's a lot of behaviors involved
Okay.
that we can sort of work to change. And there's a lot of lifestyle decisions that can be made and practiced to help, um, sort of mitigate pain or to reduce pain. So just to get back to what I was saying before, as a coach, I cannot work with a patient who has trauma. I can work with a patient who has trauma, but I can't be the one to, go back and do the deep work for
Mm.
trauma. But understanding that trauma is involved and how it imprints on our cells, like you said, on our nervous system, on our expressions. So, words we say to ourselves, words we say to others, we respond to certain situations, how we deal with pain. So, for example, some of the pain behaviors that are fairly typical is the wincing, that, "Oh," or
Mm.
or talking about your pain like, "Oh my God," or, you wake up in the morning and you're saying those words to yourself like, "This is going to be a crap day." Pardon the expression. It's going to be awful. Those are things that we can start to work on and work with and reframe to be able to say, okay, and then observe as well. So there's lots of different steps to it, but that's what a chronic pain coach is really meant to do, is to help facilitate the sort of in between stuff. So not the diagnosis part like your physician, not the treatment as far as surgery or medications, not necessarily the therapy from a trauma specialist,
Okay.
right, but more or less, what are the lifestyle things we can do? How can we challenge thoughts that are coming in? How can we help reframe situations to help you, for example, move a little more freely, a little more confidently? And how can we help you find a place of safety? How can we recognize dangers that will amplify your pain? That kind of idea.
Mm. Very
Mhm.
interesting. So I have a couple of that just brought a couple things to mind about how we talk about pain. Well, I know when I eat a lot of sugar,
Mhm.
the night before I wake up and I have a bad knee. And maybe
Uh-huh.
I shouldn't say that, bad knee. But anyway,
No,
that's
that's a good conversation to have too. So go ahead. Yes.
so but I have an well, right now it's a bad knee. It's
Mhm.
it's cartilage or something. But
Yeah.
anyway,
Yep.
so but I guess my point is, and then my L2, my lumbar spine L2 through L5,
Mhm.
they're wounded.
Yep.
And well, I had two hip replacements,
Oh.
bilateral hip replacements.
Mhm.
So I guess my question is, my body
Mhm.
is a barometer.
Mhm.
It's a weather barometer. So
Yes.
when it's, I can tell when it's going to rain. Oh,
Yeah. Oh, yeah.
it must, it, it's going to rain and then it rains. So what
Yeah.
do I tell my body and those,
Right.
my mind?
Yes.
What am I mean, is
What's
there
going on?
something I should be doing? Like,
Yes.
oh, weather don't rain or body don't react to the
Right.
change in the
Right.
atmosphere that's causing this pain.
Right.
Or what do I do?
Okay, that's a great question, because what's really important about my role is, and just about pain in general, is I'm going to try and make this as simple as possible, because it's a pretty complicated topic. But what
Okay.
we do know about chronic pain, there's been a lot of research in the last 10 plus years. It's just not getting filtered down to our community. So that's the tough part. A lot of new technology, a lot of brain imaging is really showcasing how our brain and nervous system are involved in pain. So what we've learned in all of this research is that pain, chronic pain particularly, is a sensitization issue, which means the nervous system becomes very hypersensitive. And so changes in temperature, changes in barometric pressure, changes in the weather, changes in mood, interactions with other people, really and truly everything matters when it comes to chronic pain. So your low back, for example, is often a result, this is going to sound crazy, more so of that hypersensitivity than what's going on physically in the body. Now, if I can just unwrap that one for a second,
Okay,
because your
please
brain might be
do.
going, your brain's probably going, what is she talking about?
No, I'm
Um,
very intrigued because
okay,
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 I'm
we're
very
getting there.
interested. Okay.
Okay, you're awesome. You're a good subject, a good test case for this.
Yeah.
um,
Yes, believe me,
yes,
I am.
yes. Okay, so we know that when it comes to chronic pain, some of the real challenges and some of the ways that chronic pain care is currently broken is, and it is broken, is we really are stuck in the biomedical model, which means we lean very heavily into the diagnosis, which is important, the treatment, which is important, the surgeries, the imaging. The imaging is important. We have this fantastic technology to be able to showcase when things are really needing to be addressed. So if there's something that needs to be addressed, we can see it.
Right.
But what it also does on the flip side of the coin is it often will showcase something that doesn't necessarily reflect pain. So a lot of the population is walking around with herniated discs. They don't even know it. They don't showcase any symptoms. Even young adults, 15 years and older are, if we were to do a bunch of scans on a population of 15 to 20-year-olds, they would show herniations or bulging discs. So you see an image, you hear from your physician that you're broken, or you have the back of an 80-year-old, or you have a bulging disc, or you have bad knees, those things automatically give our brain, our oversensitive brain, a sense of danger, a sense of, oh boy, I'm going to break at any moment, or I can't walk because something's seriously wrong with me, right? So it becomes really important that the more you understand about how pain works and where it comes from, then you can start to observe differently and say, is it truly because my back is going to break any moment? Or is it because I had a really stressful day at work? Or I had a really stressful conversation with my loved one and my pain is much stronger? Or, there's a lot of different reasons it could be, but I think I really want to invite people to start exploring differently. Yes, we need to know because we are so conditioned to believe that it is biomedical, and often it is. So we need to explore that too. But we also want to sort of encourage people to start thinking differently about, okay, so what is it about my knees that are problematic? Are there supplements I can take? Movement absolutely is key, but we become scared of movement because it hurts, right? And then we automatically think, oh, I've done some more damage. Or my doctor said I shouldn't be walking. So I've given you a whole lot there, and I'm sorry that's a lot to unpack, but
No, it's not a lot to unpack. It's very
okay.
interesting because you talk about movement. Because actually the day I had my hip replaced,
Mhm.
I was out of surgery, out of recovery, out of surgery, maybe 2 hours. They came and made me get up and walk. And I
Yes.
went to physical therapy every day.
Good. Yay.
And it's interesting enough that you say about, I think that stress is a trigger for pain.
Mhm.
I do agree with that. But also I remember when I had my hips replaced because there was something biological going on with that. And it was just, the pain was excruciating.
Yep.
But I was also in a very stressful relationship too. I was in a toxic relationship.
There you go.
So did that
Yep.
have something to do with it? Possibly.
Absolutely.
And
200%.
I'm sure it did.
Yeah.
Could I
It did.
not have had both my hips replaced if I had gotten out of the relationship? Now that's an
That's a very good
interesting.
question. That's a very good question.
That's
So
interesting.
that is a very interesting question. It really would have depended on again, the images were important then, right? Because they would have been able to see to what extent. Like if there was a little bit of degradation that was normal, uh, your pain might have been showing more so due to the stress that you were under. And also, if I think what's really important to understand too is because of the lived experience that you've had with trauma, that then that will already amplify that hypersensitivity of the nervous system. You already have that, and so that feeds directly into pain. I'm just looking at my fingers. I was eating beets tonight, and they're all sorry. I'm sorry. I
No,
digress. But
that's fine.
I'll have you over for some beets.
Oh, absolutely. Pickled
Anyway,
beets, pickled
beets.
beets.
No, just cooked beets with olive oil and salt
Oh,
on
well,
top.
that sounds good.
It was yummy.
Garlic? Do you put garlic?
Oh, yes, yes, yes. Mhm.
Oh, okay. Well, I'll be right over for dinner.
Okay, come on down. Anyway, sorry, I digress. Um, so yes, the trauma piece. So I guess what the most important information I can give is that if for any reason any of your listeners are living with unresolved trauma, we need to address that if we're dealing with chronic pain, because we could address the chronic pain, but if you keep going back into triggers or going back into an unhealthy, unsafe environment, that's not going to help the work on the chronic pain. So trauma is one of the things we need to address early on whenever the person is ready for it. Yeah.
Okay. Well,
Yeah.
that does make a lot of sense, actually,
Okay.
because I do notice the more stressed I am, the
Yeah.
more I hurt. But I want
Yeah.
to just take you back to Pilates.
Mhm.
I've always been interested in Pilates, and actually, I wanted to practice Pilates,
Oh,
but I
yeah.
mean, you have to get on the floor, and and I couldn't get on the
Yeah.
floor and get back up. Now I could
Yeah.
get on the floor, but I couldn't get back up. So
Right.
so do you have like modified Pilates for
Mhm. Mhm.
people who want to practice Pilates but don't have the range of motion to
Right.
do everything?
Great question. So there are two things in there that are really important. So I'm a little biased because I love Pilates. That's just part of my background. The thing about Pilates is you can modify it to the teeniest, tiniest movement. Unfortunately, the word Pilates sort of conjures up these images of people on being stretched out on these machines and, ridiculous things hanging from the ceiling. And that just provokes fear, right? When you live with chronic pain, you already likely have the fear of movement because you know it hurts, whether it be getting into the postures, getting out of them, or in the movements themselves. So it's important to understand that you can make them microscopic. So, for example, if you could find a comfortable position, whether it be seated or standing, you can move that way.
Okay.
It's a process of layering up. So we start really teeny tiny movements, and then bit by bit, as confidence and fear subsides, we can then start to appreciate movement. That's really where I think my passion for Pilates comes from. The second thing is we really need to address, and this is part of my role as a coach, is that fear of movement. So that's a whole other piece, because if people hurt when they move, instinctively, the brain's going to tell them or going to think that that is a threat. That movement that causes pain is danger. And so we need to sort of do the work to say, hey, we know that movement does not mean harm. We know that movement's going to help lubricate my joints and bring in more nutrients to help really refurbish, rebuild, just keep, healthy stuff coming into the joints. So motion is lotion.
Well, absolutely.
Yeah.
And actually, well, I think my ortho guy is he's like on the cutting edge, and he really does believe in movement
Mm-hmm.
and stuff like that. And
Good.
he
Good.
isn't real keen to cut. So
Good.
but he's an excellent surgeon. So if I ever do need a knee
Yeah.
replacement, he would be my guy.
But that's what's good, because it puts your power. So kudos to him. It puts the power in your court. You're the one saying, hey, I think it's time. I'm ready. If you've done all the homework, you really get a good grasp of what pain means and how it works. There's a real education process to it. Then you can then say, okay, I'm an equal partner at this decision-making table where I'm like, you know what? I think I've done all that I can with my knee. I think it's time. And you work with your physician. And I think that's amazing, as opposed to your physician saying it's time and you have no choice whatsoever.
Well,
Right.
that's true. But on the other thing, he told me about my hips that it really was time because of
Yeah. And
the
that's okay.
imaging. And
Sure.
I said no. And I said no for a couple of years and I tried everything
Yeah.
and the
Yeah.
pain was absolutely excruciating. And I was taking a lot of medication and I
Right.
was in a foggy state most of the time.
Yeah.
And but it was fear. I was
Yeah.
fear of
Sure.
going under the knife and I didn't
Sure.
know what to do. But like I said, he's excellent. And then once I had the surgery, it was like, oh my goodness, why did I wait so
Life came
long?
back. I know, and that's always the tough question, right? It is always a balance between understanding when the time is right, and that's why
Mhm.
your physician was so good. He said, "Okay, it's definitely time. There's nothing you've tried what you can do, and it's now time." But it sounded like you guys had a team approach, which I
Oh,
think is
yeah.
always the best way to go, right? That you have a voice as well. So I think that's really important. Yeah, there will always be pain. Chronic pain, chronic illness is always biological, psychological, and social in nature. And so what that means is there's always a biological component, whether arthritic, degenerative,
Mhm.
a torn meniscus, whatever the situation might be, there is always going to be that biological piece. But that tends to be the one piece we focus on as a society. That's 1/3 of the pie. Then you have the psychological piece. Now, the psychological piece is not at all to suggest that it's pain is all in your head, because that's not what I'm saying.
Yeah.
What we're saying is that pain is absolutely from the brain and the nervous system. And then the social piece, so the psychological has everything to do with emotions, thoughts, beliefs, core values, sort of people believing you or not believing you, support from loved ones, anxiety, depression, all those things wrapped into one. And then there's the social piece, and that kind of ties in all the loose ends, like the environment you live in, the environment you work in. What kind of culture do you come from? What sort of experience did you have growing up? Like when you fell on the ground, was there a mom going, oh my God, are you okay? Or was there a mom who's like, oh, you're okay, come on up, let's work through that together. All these things
Yeah.
impact how we experience pain. And so trauma absolutely falls into that psychological piece
Mhm.
and the biological piece and the social piece as well.
Well, it's funny you say that because it takes me back to my
Mm.
childhood and if I would say something like, "Oh, my back hurts," and they would say, "Well, you're too young to even have a back." So it's like, oh, it's just non-existent, you
Just
know.
brushed off. Oh
So
no.
you can't possibly have back pain. You're too young to even have a back.
Right.
So that's interesting. But this and this psychological piece is very interesting because when you think of athletes
Mhm.
who often play through pain. I mean,
Yes.
they'll get back on the field
Yep.
because they love the sport
Mhm.
or they love the paycheck, whichever the case may be.
Yep.
But mostly it's because they love the sport.
Right.
Um, and well, they're 80% or 70% or whatever. They may be even 50%.
They're
But
going back.
yes, I guess my point is psychologically they're able to perform through the pain.
Mhm.
So,
It's a good question. Ooh, you got some good ones today. Okay, so this is an interesting topic because there's a couple of things that we could talk about with that. So yes, athletes uh traditionally will be a little more used to pushing through the pain. Now, is that a good thing? Not always, because we know that pain, and this is going to be a really important, if they get nothing else from this talk, this one nugget is really important. Pain is, sorry, I'm having one of those senior moments. I totally forgot what I was going to say. You can edit this part out if you want. But pain is absolutely both acute and chronic. And so acute and chronic, pain is meant to protect.
Mhm.
Okay. So for the athlete, for example, when they experience pain, more than likely it's because of an acute injury. There was some
Right.
damage to the tissue. And so the body is then creates pain to say, don't put any weight on it, don't run on it, don't, so that they can start the healing right away. And we
Mhm.
start healing right away if we allow for that environment to be in a state of
Right.
repair, right? And so, but oftentimes, and unfortunately, and psychologically speaking, just for athletes, yes, they are used to more pain, so they might push through. Then there's the context of, well, is there pressure from coaches to be out there sooner than later? Is there the context of, oh my gosh, if I don't play now, I'm not going to get paid or I'm not going to get promoted. There's a lot of context around that, and is a great
Exactly.
example, right? And so, we know, though, that if they continually push through that acute pain, they're not going to heal properly. And then the chances of it becoming chronic is much more likely. And so, yeah, we do have to find that balance. I have an athlete son who plays hockey, and we're always finding that balance. Okay, you hurt yourself. Let's just give it a little time to recover so that you can go longer
Right.
with your sport. Yeah.
Well, fantastic.
Mhm.
So do you have maybe one or two little
Yeah.
um simple exercises that we might be able to take away, us chronic pain sufferers,
Yes,
uh,
absolutely.
uh, um trauma survivors who also suffer from chronic
Chronic.
pain.
Love
So
it.
what do
Yes.
you have for us today?
Okay. You're going to think I'm crazy, but this one, this one is simple to do, unless there's some limitations, and I'll talk about that in a second.
Hmm.
This is actually coming from some of the lead researchers out of Australia. So there's a gentleman by the name of Dr. David Butler and Lorimer Mosley, and they are doing a lot of research around what chronic pain looks like and how to work with it. They have discovered that if you take, okay, you're going to think I'm crazy, but it's,
Okay,
here we
well, try me.
go. Okay. I'm going to leave you hanging here. All you do is you take one arm up and over your center line. You have to cross over your center line and you have to go above the head. So if
Okay.
you have a shoulder restriction, that's going to be difficult. I get it. But you can also get someone to lift you up and over. Even the motion of, even if it's someone who's lifting you up and over, and you have to alternate side to side. So you get one
Okay.
arm going up, then the other. You have to cross over the center line because that's key.
Okay.
What
Oh,
this
in front or above?
just above and past your center line. So this is my center
Well,
line.
I'm in that virtual world here,
Yeah,
but
it's hard to
yeah,
see.
I'll
But you
try
can do
that.
it in front of
Okay.
a mirror. Yeah, try in front of a
But
mirror.
am I supposed to be straight up?
Just well, you can be slightly in front as long as the key part is going past your center line.
Okay, so I think I'm past my center.
You are. You're looking
Okay.
good.
And
Yeah,
then
and
we
you're
do
just
that?
doing this. Yeah, you just keep doing it. And what
Okay.
this does is helps to descramble the brain a little bit in the moment
Okay.
to sort of distract from the pain. So if you are in pain, no, it's not going to work right away. You have to keep doing this. So I would say do this every single day. There you
Mm.
go. To help eventually sort of calm the brain down a little bit.
Oh, so it descrambles my brain. Okay. Mm.
Just, my
I probably
brain
need to do that
feels,
more than more than every day. Well, it's 2 or 3 times a day.
I think I've
It's
done
gonna
it too much.
descramble my brain.
I think I've done it too much. That's why my brain's all scrambled. Just kidding. So
No.
that's one
Okay,
small
that's
thing.
one.
That's one small thing. The other thing is, now the thing that I think is important to understand is that it is a real process. It's, just like coming out of addiction, it's going to take time and practice. So there's not going to be a quick fix. However, one of the quickest things you can do when you are in a pain flare or in a state of anxiety related either to the trauma or the pain or both is the breath. Now, some people get sick and tired of hearing this because the doctor will say, well, just breathe. Well, that gives them not a lot of information,
Right.
but we know that sort of physiologically, if we can slow down the breath, that is the quickest way to bring that blood pressure down, slow the heart rate down, and bring you into a state of parasympathetic activation, which is meaning the rest and digest as
Okay.
opposed to the fight or flight. Okay, so just taking breaths, even just placing your hands on your ribs
Okay.
and just taking a breath in, just trying to expand the ribs and then breathing out, letting those ribs collapse. That's all. Inhaling, allowing those ribs to get bigger, and then exhaling, allowing them to come together. So now, the only thing we have to be careful of is that deep breathing
Mm-hmm.
can sometimes bring about emotions, deeper emotions. So if ever your listeners are trying to work through, I've got meditations they can listen to on my YouTube channel that are free. If they find themselves in a situation where it's really bringing in those deep emotions, they are invited to just take a breath and slow down and step away from that practice. There's a couple of practices out on my YouTube channel that are sort of, one is like a container imagery where you can, if you're really in a tough spot, you can just sort of put it away in that container for a little
Okay.
bit. And then there's another one that sort of is the eye of the storm, where if you're really in a bad place, you can go into sort of a safe space because safety is key for trauma survivors as well as for chronic pain. So that's an option as well. So those are sort of some quick things you can do to help in a moment. And again, if it's still persisting, just reach out to someone who is informed in chronic pain or trauma, or both.
Interesting.
Yeah.
Well, that is very, very interesting. And I think that little exercise descrambled my brain a little bit because my back isn't hurting quite so
Oh,
much.
really? Oh, good.
But
Good.
so it stretched things out a bit.
Good. Movement.
So you have want to talk a little bit about your pain academy, the Change Pain Academy.
Yes.
So tell us a little bit about that. How do people connect with you
Sure.
and things like that? Oh,
Yeah.
before you answer that,
Yes.
no, I'll wait, but I don't want you to leave without telling people how to connect to you on your YouTube channel.
Oh, sounds good. Yes, I
Okay.
will. I will let you know that for sure.
Okay.
Okay, so the Change Pain Academy, again, came from a place of feeling like there's much more that we could do. So there is a huge gap to fill, again, between sort of the physician care and the chronic pain warrior. There's a lot of information to understand or to learn about so that you can make informed decisions.
Okay.
So the Change Pain Academy is really a complete ecosystem where we bring people in, we take them through a learning path where they're learning about the fundamentals of pain.
Mm-hmm.
Now, I know you know pain because you live with pain every day, but what I really want to introduce you to is sort of the fundamentals of pain, how it works, where it comes from, how things amplify, how to find safety, what are our triggers, all that stuff. The more we understand. So understanding pain changes pain. That's really important to understand. And then once you're in there and you're working through all these lessons, we do the coaching as well. So we come together, we work and we implement on those new skill sets, maybe challenge some thoughts that are coming up. And then we also have a library of everything to do with chronic pain. Now it's growing. We are early days yet. So every week we're putting in new content, but we address sleep. We address communication. We will be addressing at some point, as soon as I can get it done, sexual health, relationships, everything to do with chronic pain. We do it there. And then the best part of it is that we do it in a community, and we have a community space. It's not Facebook, that we connect, we lean into each other, we celebrate each other's wins, we ask questions. So it's really a space purely for chronic pain warriors and sufferers, champions, whatever you want to call yourself, where we learn and grow and transform.
Wow, that
Mhm.
is very interesting. And I noticed there was yeah, we talked a little bit about that. The mindset puzzle and how anxiety, depression,
Oh,
and
yes.
all of that affects pain. So could you just touch on that just a teeny weeny bit?
Absolutely. So mindset's one of those words that I used to use a lot of, but I'm trying to sort of curtail because unfortunately our chronic pain community is hearing that word a lot from their doctors saying, well, we got to work on your mindset. Well, first of all, what does that mean?
Exactly.
Right? So our mindset is more or less talking into that psychology piece. So the anxiety, the depression. So yes, anxiety impacts pain directly and pain impacts anxiety directly. So the two work hand in hand. So the more we can explore understanding that emotions show up in our body,
Mm-hmm.
for example, anxiety. All my kids have anxiety. Their stomach will respond very quickly when they're having moments of anxiousness or worried about something. I think most humans would say that. The butterflies in your stomach, right? Those are just
Right.
physical responses to emotions. So, yeah, the mindset piece really falls into the psychological part of the biopsychosocial model of pain,
Okay.
where we want to address also. So, if I can give a clear example, we know that chronic pain is that hypersensitivity.
Mhm.
Anxiety is the same way. So we actually do a lot of the same work. They overlap. And so when you work with anxiety, you are also working with chronic pain and vice versa. So
Okay.
sometimes it's just a gentle exposure to certain things to build up that tolerance, to build up that confidence bit by bit so that it's not overwhelming. It's not anxiety provoking and it's not pain provoking either. So there's ways, we have methods to our madness as far as how we can work through, that heightened state of anxiety, the psychology, the depression, all of those things that kind of muddle into chronic pain and trauma.
Well, that is so fascinating. And I am a believer. I do not think you're crazy at all. I know our bodies remember the
Yeah,
trauma.
they do.
So, and it reacts, and because certain sounds and
Right.
smells and
Yes.
um
You're right.
you trigger memories and physical responses. So
So
I don't think you're crazy at all. And so before you go, is there anything that I forgot to ask, or what one thing do you kind of
Mm.
wrap up and want people to take away from our time together today?
Right. Oh, okay. Great question. I'm glad you asked because I think what's really important to understand is there is hope. So there are a lot of people in dark places because of chronic pain, especially, but also with trauma. I just watched a beautiful YouTube, and I can send you that link if you'd like.
Oh, I
The
would like.
amount, yeah, what we are learning these days with the power of brain imaging
Mhm.
is incredible. We know that our brains are bioplastic, which means that we can change. Like our brains can change. So even if you've been through trauma, and trauma doesn't have to be a huge life event, it could be micro traumas, it could be medical trauma, it could be, there's so many instances of pain, of trauma,
Mhm.
that we know that with these brain images that whatever it took to get the brain to that place, it can change, it can shift. We are very plastic, we are very adaptable beings, so there is hope. It just takes, and I think you are probably a very good example, Peggy, of the work that you've done to get you where you are now based on the lived experience that you've had. And so, you are a good example to others to showcase that, yes, it takes patience, it takes persistence, and it does do a lot of deep work. It is deep work, which I fear a lot of people are not wanting to do, right? We want the quick fix. We want that just get me out of pain.
Yes, it does take a lot of deep work, and I have find, because I have a friend, and I say to her, let's do the deep work. She says,
Yeah.
no, it hurts too much. So,
Oh,
I mean, I get that, because
mm,
doing the deep work was hell.
hard.
It
Yeah.
was hard. But
Yeah.
just like I um I delayed my hip replacement for 2 years, and I was in excruciating pain. And
Mm,
then the surgical pain and the physical therapy was short lived. You know,
mhm. Yeah, that's right. And it's
uh,
easier. now that you're here, right, in this moment to say, yes, it was hell, but it was worth it. It's hard to feel that way when you're in the moment, and it's hard to get motivated when you're in that deep moment, but you did it. So,
Well, the thing of it is, I think it is, well, when you're in so much, when the pain of change,
mhm,
no, when the pain of staying the same
yes.
is greater
Mhm,
than the fear of change.
absolutely. Yes.
So that's what it is. The pain of staying the same. I was
Yep.
miserable when I needed that hip replacement. I couldn't
Yep.
live like that anymore. I said,
That's
I'm
it.
going to
Yep.
do it.
That
And
was your
then,
TSN turning point.
yes. And when I was out there drugging and out of my mind, numbing myself from the pain of the trauma, it was
Mhm.
like, enough. I can't live like this anymore. So
Right.
then that was the turning point for that. So
Right.
thank you. So as you said, pain is very useful.
Mhm.
And it does let us know that something's wrong, but we don't necessarily have to live, we don't have to let it control us. And there are definitely things that we can do
Yep.
to control that. And one of those things we can do is contact you at the Change Pain Academy and go to your YouTube channel. So what is that?
Right. Okay. So before I get to that, one last thing. So sorry. The
Okay.
one thing that I just want to clarify is that I'm so sorry to make this longer than it should be, but
No, it's fine.
the pain serves its purpose, especially in the acute phase when you have a true injury. Um, it becomes problematic when we get into chronic pain. That's when that hypersensitivity comes in. So I just want to make sure that people are clear, because finding that balance between the two can be difficult, knowing if it's acute injury or if it's chronic. Anyway, I'll leave it at that. You can reach me at any time. I'm always open for conversation. My email is Deana, Deana, at pain, and then it's the number 2, possibilities.com. My YouTube channel is also pain, number 2, possibilities, with the S on the end. And there's lots of free resources in there. There are some Pilates recordings, but I wouldn't recommend diving into those quite yet. those are more advanced, but there's lots of breathing. There's some meditations in there, lots of options there. And the free gift that I'm going to be giving as well, if it's okay if I touch on that,
Oh, sure.
it is meant to help you, the chronic pain warrior, but also your loved one help you to be a better support, because we know that people who have a healthy support system, like a loved one, makes the pain far less problematic, and they can be more productive and live a healthier life when you have that support. And so the freebie is really meant to help both of you, but primarily the person that's lives with you.
Yes, because a lot of times if you're in pain and your significant other is saying, "Oh, well, you're so lazy. Why don't you get up
Yes,
and do something?" And you're like, "Well,
exactly.
I'm
Making the pain
damn
worse.
you."
It's true. They don't realize they are, but they are. So,
Yeah.
so it's really meant to guide them, and you can work through it together, because it's really important to be a team, right? And find a way to work together.
Well, wonderful. Well, I'm gonna before we go, I'm gonna share my screen so we can take a look at your how to connect with you. Um, let me see. Okay, there we go. Let me move this thing out of the way. Oh,
Sure, that's
I don't
okay.
know. That's gonna be on my recording, but I don't care.
That's
This is,
okay.
oh, I did it again. Let's not even, do we want to try that? Let me get the bubble head out of the way. And then maybe I'll do it that way. Okay, there we go. Okay, connect with Deana. Facebook, she is Deana Trounce.
Chopolis.
Thank you, Deana.
No
And
problem.
she's offering a free gift on care. It's called Care, caring for a loved one with chronic pain.
Mhm.
So I'm going to stop sharing my screen. So take a screenshot of that, but we don't have any links here, but I'm going to share the links with you, my audience, and you'll be able to get your free gift, and you'll be able to connect with Deana to get all these wonderful resources on dealing with chronic pain, aside from medication, because I do
Exactly.
take some
Yep.
serious meds, but
Yep. Yeah, meds are important for sure. But eventually, the more you know, the more you can make those decisions. So
Absolutely. Absolutely. And then that's really one of those where the doctor is definitely going to make it for you too, because the feds are on their back in terms
yes.
of how much they prescribe. And
Mhm.
this is my soapbox, that there is pain is the only disease, the only I don't know if it's a disease, but the only medical condition that the doctors will not give enough medication to
Mhm.
handle the
Mhm.
diabetes, because they don't say, well, you need okay, your blood sugar is this, it would take 100 milligrams of insulin. I mean, I'm just pulling these numbers out of the air, I don't know anything
Mhm.
about it, but I know
Mhm.
you need a certain amount of insulin to
Yeah. Yeah.
monitor your blood sugar. But the doctor would say, oh, well, you need 100 milligrams, but i'm I'm afraid you're going to get addicted to insulin, so we're only going to
Mhm.
give you 50 milligrams or
Right.
whatever. Or
Yeah.
we, so that's my soapbox. Do
It's a bit
people
of a
take
mess.
advantage? Yes.
Yeah.
So, but
Yeah.
it's a catch-22. So I don't want to get on that soapbox, but you have definitely given us food for thought. I've gotten my exercises coming over center.
Girl.
I'm going to go to your YouTube channel and check out some of your breathing exercises and your movement exercises, and get back with it. And Dina, I want to thank you so much for joining us today.
Thank you.
And just thank you. It's been wonderful. I've been absolutely educated on chronic pain and how it's affected by trauma.
Mhm.
And I don't think you're crazy at all.
Oh, thank you, Peggy. This has been a lot of fun, and I hope your listeners really get to gain from this whole summit that you're putting together. I think it's really important.
Well, thank you. And it's been a lot of fun for me too. And thank you so much.
You're
And
welcome.
I'll be talking to you soon.
Sounds good. Thank
All
you.
right now. Bye-bye.
Bye.
Okay. Okay, there we go. Bye-bye.